So I wanted to jump on. I've just discharged a 6-year-old that was in, who had come in with, it was a really painful Verruca. So Verruca, human papillomavirus, it's a virus, and an absolute pain in the bum to clear up, because you essentially need the body's immune system to clear it up. And so anyway, this had been going on for quite a while, and it was spreading over to the other foot as well, because they do spread. And so yeah, it's just been great today to finally discharge him. Well, not finally, he's 4 sessions I've seen him for. And we went, there's different modalities that we can use. Now, this was a 6-year-old. It was really, really red and inflamed and sore. It was on his heel, and it was massive. It was really, really big. And usually Verrucas aren't sore, right? They're not usually something that's sore. You pick them up usually swimming, trainers that are a bit sweaty, and then your bare feet, and they pass really easily. And it's usually kids that pick them up. It tends to be wee boys, but it tends to be kids. If you're immunosuppressed, you can be more susceptible to them as well. So if you get anything where like rheumatoid or MS, anything like that, you're maybe more susceptible. Anyway, so all cleared up, fantastic. Mum's absolutely delighted, and all Verruca's gone, discharged today. But what we did with this wee one is we used a solution on it. So essentially that mummifies. So this here, I'll show you, is what I was using. So we used a thing called Verruca on him, and it comes in a tiny little vial, and it basically mummifies the Verruca. So it's like a tiny little vial, prescription only meds here. You probably can't see the tiny little amount that we put on this. And it's painless. First thing that I would do though as a podiatrist is I debride the area. So I basically reduce the area down. Generally that is painless. Sometimes we need to use local anaesthetic if it's particularly painful. The first time I saw that wee boy, I did need to use a local anaesthetic. So we usually use something like this. This is Scandinase, 3% plain, so there's no adrenaline in this. And essentially, we put these into the single-use needles. And yeah, that's probably the worst bit, is getting a wee injection in. But usually we would just go locally and just numb around the area. So it's pretty non-eventful, really. But that's usually that puts people off needle. You generally don't need that. But if it's really, really sore and you're unable to tolerate me reducing the area, then we can numb the area down as well. We did do that with the first time, and it really allowed a good reduction of the Verruca and then the Verruca on top to mummify it, and it made a massive difference. So the second appointment that I seen him for 2 weeks later, the inflammation was all gone, he wasn't in pain anymore, and it was a case of he didn't need a local anaesthetic with any of the other appointments. He had 4 appointments in total, 2 weeks apart, totally gone. And to be honest, even after the last one there, we were just being a wee bit more cautious. So we saw him 2 weeks later, seen him today. He's just away, discharged. That's him, done. Thank goodness. So that's one option for the Verruca. Verruca tends to be quite, it's painless, right? It really is. But the only issue with that I would say is that you're coming usually a week apart or 2 weeks apart, usually anywhere between 3 and 6 sessions you need, and it's £50 per session. So that can work out quite expensive, right? You could be up to £300 to deal with the Verrucas spaced over every 2 weeks. So £50 a session. So that actually, when you add all that up, can be quite expensive. And also it's time out of your day to come to these appointments. I mean, you're only usually in 20 minutes. It's not long. Depends if you need a local anaesthetic, you'll be a bit longer. But and if you need a local anaesthetic, it's £85 to get the injection if so on top of. But generally, you don't need that. Now, the other option that we do that requires just one session is Verruca needling. Now, Verruca needling, what would happen in that appointment is we would basically put the plantar at the bottom bit of your foot to sleep. So we would inject into, I'll show you my foot. You see it? We would inject here, and we would take out this nerve here that feeds the bottom of your foot. So we'd essentially numb that full area so you wouldn't feel anything. Is it sore? It's just a wee bit nippy, that's it. It's not really sore. It's just that I think the thought of that is worse than actually the reality. So we basically do what's called a tibial block. So we take out the tibia nerve, which feeds the bottom half of your foot. And then what we then do is we need to create an immune response. So we basically, with a sterile needle, we needle the area. So we essentially create lots of little puncture wounds, and we push the Verruca virus into your bloodstream. And the reason we do that is because we want the body's immune system to recognise there's a virus there and to stimulate an immune response. And that clinically is the most effective treatment for Verruca. You can get things like cryotherapy, you can get debridement, occlusion. Do they work? It depends on your immune system, but things like cryotherapy can be quite sore. You're probably, again, with similar to Verruca, you'll be probably 50 plus more a session. You'll need a few sessions usually. Similar, but it's sore. You've also got Swift, which is microwave technology, where we can heat it up. Basically, it's hot for like 3 seconds. We usually do that for a total of like 3 times in that session. That can be quite effective as well. But again, you're coming to the clinic more often. So really, there's lots of different options. Some are better than others, but the most effective is Verruca needling. Okay, but I think it means you only need to come to the clinic once. We stimulate that immune response. We then basically put a little dressing on it. You leave it alone. It feels a wee bit tender for a few days. Just feels bruised, to be honest. That's it. We then see you usually a week later. You don't need to really come in, but if you want to come in, there's no extra charge for that. You can come in and get a little assessment, just check that everything's going okay. And then usually we don't see you again for 6 months, and it's really just a checkup. And again, you don't need to come in, but it's part of your package. Verruca needling is £280 for that full package, and that includes the procedure and it includes any follow-up visits. So you're one a week later, redressing change if you need it, and 6 months later for a checkup. And again, I think what the Verruca needling can do is you're not having to come to the clinic every couple of weeks or every week. So with Verruca, when we're putting that on, depends on each patient. Usually I do it like maybe a week to 10 days apart. It just means that you're committing maybe for the next few months, coming in every few weeks. So it's just, that can be put off, isn't it? You're having to come in more often. Whereas the Verruca needling, it's done once and that's it. And it's the research on that shows that it's the most effective treatment out there, because really you're pushing the virus into the bloodstream. So it's awesome. But I have to say, for wee ones, I'm loving the Verruca, right? So we can put this on from age 6 up. Can't do any younger than age 6. And I have to say, I've been getting amazing results with it. It does require reduction prior. I'm always quite deep with the reduction because I want to basically get the immune system doing something. And then it essentially mummifies the Verruca. And essentially just in the end, it falls off. You get everything you need. So in your appointments with us, you would get absolutely everything you need. So in terms of if you were booking in for a Verruca, you would get an assessment. We would get you started, check that you were indicated. So things like pregnancy, we wouldn't be able to do it. If you're under 6, things like that. If you had like maybe skin conditions where you had open skin, there would be some issues there. But we'd need to assess you individually. But the success rate so far, clinic-wise, for myself, has been every Verruca that I've seen, we're probably about an 85% success rate. I mean, that's amazing. It really is amazing. And usually not needing to go near the kind of 6 treatments, usually around that kind of 3-4 treatments we're getting there with that Verruca. It's absolutely excellent for kids because it's not sore, right? There's no pain with it. It's a lot of the other treatments are a bit more invasive. Like I'd be reluctant to do Verruca needling on a kid. It's just a bit much, isn't it? So, getting a big needle in their ankle, not really needed, unless it is really needed. And I've done that with was a young girl who's immunosuppressed that I did we did Verruca needling with her because it really was, her Verruca was causing her such distress, and it was really sore. She could hardly walk on it. It was on her heel again. It was like a big cauliflower. Honestly, it was huge. And she'd been to another podiatrist elsewhere who had been using, I think, salicylic acid on it. Just wasn't getting, she was just demented, and she asked me if I would do needling on it for this particular patient. So she sent it over, and we did. So it was a wee bit, that's kind of, I wouldn't do that first off, but that was an extreme case, and it was just great to see that clear up for her. So within, I think about 2 weeks later, she was able to walk again normally and not like limping and frightened. And then the wee soul was getting issues with because she was limping and not able to do PE at school and things. Her whole posture was all off, and then she was getting knee pain on the other side of her leg and stuff. So there was all that other stuff that was going on that because of how she was walking. So it was a great one to clear up. But we did do Verruca needling with that. So if your kids, the reason I'm jumping on to see if you've got wee ones with Verruca and you're going into the chemist and you're buying Donson's Bazooka, that Verruca, you're more than likely just chucking your money away, and you're not generally going to clear it up. You really need a podiatrist to, one, assess it, but it's that reduction, right? So we use a scalpel and we reduce that all down, and we've got other modalities there to reduce it further if we need to, right? And that really is the key, and then putting the medicine on it. So do not subject your weans to torture. There's other things like using maybe surgical spirit in between appointments with us. So when, for example, you're coming in with a Verruca top, you're getting the advice and the care all the way through that. So we're assessing, diagnosing what's going on with that Verruca, or if it is Verruca, because it might not be a Verruca, and a proper treatment plan to take them through that. So whereas if you're just buying over-the-counter stuff, most of them don't work. It's the same with people that maybe buy corn plasters, and you think, oh, dear Lord. So book in, see a podiatrist. So we are based in Kinning Park in Glasgow. So if you're struggling with Verruca, if your kids have got Verruca, the best advice I would give you to is just now, cover it up. Don't let them walk about barefoot because it will spread. So a little bit of tape over it, keep it covered, even a plaster over it. Just that's the easiest thing you can do. And book in and see a podiatrist and get a proper diagnosis and advice. Even if you're just coming in and getting some advice, and we don't do anything, maybe you're just needing some advice. Is it a Verruca? What should I be doing? You can absolutely do that as well. There's no need to do a full treatment plan. If you have any questions on this, don't hesitate to ask. I'm going to jump off now because I've got another patient in the waiting room. I hope you're all enjoying the sunshine. At least it's a lot better than yesterday. Dreep rain. I'll see you all later. Have a good Monday.